is Vancouver Island Report.
Good evening. Nurses at Nanaimo Regional General Hospital say tonight their working conditions have reached a crisis point. They say patients are packed wall to wall inside NRGH and staff are run off their feet just trying to keep up. The demand is forever increasing, but the supply of beds and the staff is not. And the nurses and others say something needs to change, and the Vancouver Island Health Authority must take responsibility for making that change. CTV's Scott Cunningham reports.
Nurses feel that they've worked beyond their limits, they haven't met their standards, and there could have been a potential for disaster.
It's a shocking statement coming from healthcare's front line. Nanaimo nurses say patient care is rapidly declining inside Vancouver Island's busiest hospital, and a scalpel needs to be taken to the system.
Nurses aren't meeting their professional standards, which means that they're not providing the quality of care in the work site that they need to be.
A drastically overworked staff and a hospital dealing with large-scale overcrowding is being blamed for nurses burning out and filing complaints with the Vancouver Island Health Authority.
What are you hearing from the nurses?
I'm hearing at the end of the day they're being overworked.
It's Jonathan Selkin's job to listen to nurses, and the union steward says what he is hearing from Nanaimo RNs is not good.
Frankly, I worry about them, and that's, how do we meet the needs of the patients is the big concern.
According to union representatives, overcrowding and demand on nurses is taking such a toll that some RNs are seeking medical help themselves.
A lot of them are stressed to the point of having to take medical leaves to take time off because they cannot handle the workloads anymore.
The union is now demanding the system undergo a rehab of its own, saying patients will only receive proper care if a nurse-patient ratio is put in place, meaning one nurse will only have to deal with a set number of patients per shift. VHA is willing to listen to concern, but say the root cause of these problems is overcrowding, and that isn't going anywhere until more long-term care beds are made available.
The pressure comes from our aging population and their more complex care needs, and the fact that many of them need care outside of the hospital, and we need to develop those resources.
Just under 700 long-term care beds are available in the Nanaimo region. Not enough to ease pressure on the hospital now.
Patient care now is suffering. We hear it every day.
And unless more are created by the province and VHA, not nearly enough when a wave of baby boomers start needing extended medical care. Scott Cunningham, CTV News, Nanaimo.